Good afternoon, and Vice President for Quality and Patient Safety here at the VHHA. On behalf of our Center for Healthcare Excellence and our Virginia PSO, we would like to welcome all of our colleagues from across the state to our third season of this monthly webinar series featuring successful strategies from Virginia hospitals and health systems promoting safety culture and high reliability. I'm glad to present today our colleagues from the Mary Washington Healthcare System in Fredericksburg, Virginia, in their presentation entitled Increased Awareness and Reporting of Near Misses, Good Catches, and Unsafe Conditions in a Small Health System. Our presenters today will be Dr. Rebecca Bigany and Michelle Hungerford. After the presentations, we will have a few minutes for questions, so we ask that you type your questions into the text box. I'm going to ask my colleagues from Mary Washington if they have control of the slides, if they can move to the next slide, and I will review the housekeeping. So my colleague at Mary Washington, are you able to move the slide?
Well, we were, and just a second.
She's got it. She's got it.
Do you have it now, Jennifer?
There we go.
There you go. Perfect. So the slides for today's webinar were sent to all of our participants this morning, so they should be in your phone option to call in. All participants will be muted, and again, we ask you to type any questions or comments you have into the question box, and we will respond to those at the end of the webinar. Once the webinar is concluded, there will be a feedback survey that will be launched to all participants. We encourage you to take a few minutes to give us your feedback on this presentation so that we can continue to provide high quality programming for all of our hospitals. So without further ado, I will go ahead and turn the presentation over to Dr. Bigany and Michelle Hungerford at Mary Washington.
Thank you, Abraham. Good afternoon. I'm Rebecca Bigany. I'm the Chief Medical Officer at Mary Washington Healthcare. Michelle Hungerford, who is a safety coordinator here, and I are delighted to talk to you today about our efforts to improve safety event reporting in our healthcare system. Mary Washington Healthcare is a not-for-profit hospital. Mary Washington Hospital is a 451-bed regional medical center, and we have Stafford Hospital in Stafford County, which is a 100-bed community hospital. We also offer comprehensive outpatient care through over 40 facilities and services, including physician practices, home health, hospice, ambulatory surgery, outpatient rehabilitation, imaging, cancer centers, retail establishments, and properties. We embarked on a high reliability journey and starting in 2017 in partnership with HPI, which is a Presgani company. Initial steps included evaluating our safety culture with a variety of tools, among them the AHRQ Patient Safety Culture Survey. Like others in healthcare, we recognized that we were experiencing underreporting of safety events, especially those events that didn't actually cause harm, whether they would be considered good catches, near misses, or unsafe conditions. To improve safety for our patients and associates, we knew that we needed to increase the recognition and reporting of these conditions and situations that created the potential for harm, both in our clinical and our non-clinical areas. Because it's the recognition of those non-harm events and conditions that not only provides us the opportunity to proactively address those situations and correct what may be unsafe, thereby decreasing the potential for harm, but at the same time, we wanted our associates, our workforce, to look around them and be aware of the importance and existence of those areas of risk. And our safety culture survey confirmed that one of the major barriers we found to reporting events was the fact that our reporting system was not user-friendly. So Michelle Hungerford will tell you about some of the things that we did.
Thank you, Dr. Bigany. To increase in reporting, we launched a fun, aggressive marketing campaign that was created to foster enthusiasm and competition around reporting of near misses, good catches, and unsafe conditions. We started with 2 contests. We had a Raise the Flag for Safety challenge, which challenged the organization to come up with an innovative way to improve the ease of reporting of safety concerns. From this competition, a safety email and a safety hotline were created. Concerns raised regarding reporting included too cumbersome or not enough time. The safety email and Unsafe hotline created an avenue for associates to quickly and easily speak up for safety. We currently have about 25% of our safety concerns submitted via the email and Unsafe hotline. We also had a good catch contest, which not only encouraged associates to take a more proactive approach to safety, but it was a great way to encourage the use of the new options to report a safety concern. The contest also increased situational awareness for clinical and non-clinical associates of situations that have the potential to cause harm. This flyer here is one from one of the flyers from our Raise the Flag Challenge. You can see that we had so much engagement that we had to extend the deadline to keep the ideas flowing. This very cute, one of my favorite flyers here, is our wanted flyer seeking good catches and near misses, posted during our Good Catch contest. This chart here displays the overall reporting of near miss and unsafe conditions. And just to clarify, good catches are pretty much incorporated into our near miss and unsafe conditions categories within our safe reporting system. So this represents Mary Washington Healthcare as a whole, and it is from October 2016 to April 2019, with again our baseline being the first quarter of 2016. Reporting of near misses and unsafe conditions significantly improved following the implementation of the safety email and the Unsafe hotline, which were both rolled out during the same time as the Good Catch contest. We exceeded our goal and increased in reporting by 190% from quarter 4 2016 to quarter 4 2017. You can start to see a decline starting with the second quarter of 2018, which was expected. However, the average number of reports was still much higher compared to the previous years. In 2016, we averaged about 76 near miss and unsafe condition reports. In 2017, we increased to an average of 244 reports per month. In 2018, we continued to see an increase and averaged 451 reports per month. So far in 2019, we are pretty much holding steady with an average of 450 reports per month.
And those are the good catches, near misses,
Good
and
catches,
unsafe conditions,
absolutely.
besides our actual safety events.
Yes. But overall, with reporting in general, we've seen an increase in reporting. So we wanted to share with you some of our top reported categories for those near misses, good catches, and unsafe conditions. The increase in reporting has allowed us to trend safety concerns, identify areas of opportunity, and put actions in place to address them, which supports our commitment to provide safe and reliable care. A lot of these listed here have either an action put in place or a PI project has been started. So we wanted to get that information back to the front line, just to let them know that their voices were heard. We partnered with our marketing department and developed this newsletter to share common themes reported and to share some of the action items that came out of the frontline speaking up for safety. This is still an active practice today. It went beyond the Good Catch contest. One example that Nicole provided, actually, because she was going to present, was pretty much around our high priority equipment allocation and workflow. So associates consistently spoke up for safety when they did not have the proper equipment needed to provide timely care to our patients. In this case, it was around the IV pump. As a result of multiple safety concerns voiced, nursing leadership partnered with supply chain management to improve IV pump utilization and return workflow. This project is ongoing and has had a significant impact on patient safety, as well as associate satisfaction. There was a lot of back and forth regarding pumps. People were hoarding them, so it's definitely improved in associate satisfaction in that regard. We continue to take steps to keep the organization engaged and to let them know that their voices are being heard. One example is the implementation of a new safety event reporting system. This new system has many benefits. Entering a safety event or concern is much easier. The event categories are now consistent with AHRQ and CSO guidelines. Leadership accountability has improved tremendously. It offers closed-loop communication right directly within the reporting system. We can easily pull reports and assess trends. We recently conducted the AHRQ survey as well, and our baseline survey was done in 2017. This gave us a good gauge of what improvements we've made and what opportunities we still have with a lot of the work we did around our HRO, which started about 2 years ago. We saw shifts in the positive direction for a few areas, including frequency of event reporting, and actually we were significantly higher than the external benchmark in this area as well. Correct me if I'm wrong, Dr. Higgins. Was there anything else before we move on to the next slide that you wanted to add around the survey?
Okay. So just certainly we recognize increased awareness throughout our system of the importance of safety.
So this picture here is a snapshot from our 10 Safety Commandments video, which was a fun way to engage associates and to reinforce HRO safety behaviors and error prevention tools. And for those of you that attended the 2018 HPI Press Gaming Safety Summit, you will know that this video won most entertaining. So thank you for those that wrote it.
And there is a link there if you'd like to watch it. It's based on a song from the musical Hamilton, which a lot of people addressed that way.
And you can see in the bottom right corner, we have our great catch as one of our signs, and then in the middle and the back, we have about speaking up for safety. So it did reinforce a lot of this project work.
In conclusion, creating a fun, competitive environment to increase our associates' awareness of unsafe conditions has resulted in increased commitment to reducing avoidable harm and has contributed to the ongoing evolution of our high reliability journey. Some of the next steps include ongoing reinforcement of HRO safety behaviors and tools for leaders and associates, our safety coach program, which started in January of this year. We plan to expand this program late this summer by recruiting our second wave of safety coaches. We are also looking at ways to enhance our recognition program for associates and medical staff who identify near misses, good catches, and unsafe conditions. So thank you again for allowing Mary Washington Healthcare to share the steps we took to increase awareness and reporting of near misses, good catches, and unsafe conditions. At this time, we would like to open up questions.
So Dr. Bigney and Michelle, thank you very much for an excellent presentation. I don't actually think I've seen that video, so I can't wait to go out and pull it up on YouTube and look at it. And congratulations on being recognized at the HPI event. I will encourage our participants, if they have any questions, feel free to go ahead and type them into the chat box or the question box on your screen. While we wait for any questions to come in, I do have a couple of questions I would like to pose to the team. You guys have identified apparently 3 different ways that folks can submit near misses or adverse events: through your event reporting system, which you refer to as MIDAS, your iSafe phone line, and your email box. Do you guys at some point put all of those events into one system? Do they all eventually end up in MIDAS, or do you manage them separately and just track the numbers in aggregate?
Well, first, we actually moved away from MIDAS. Our new system is part of the VHRQ system. And we do put events that come in through any route into the VHRQ system. So we do have all those events recorded. If someone submits something through the other mechanisms that requires more investigation, we may ask that they put the report in VHRQ, but our safety coordinators generally put the reports submitted through the other 2 mechanisms into VHRQ. So we're still able to submit those to the PSO, to send those for feedback from the managers, to do the closed loop if there's an action plan needed.
Okay, I'm just curious, when did you all move to Verge?
Starting in January this year.
I have a question. I'm trying to get to it. So the question from our attendee is, was your safety reporting email link and the hotline in addition to some other formal type of reporting venue? And was this primarily a manual sorting to determine your data? I think that might be related to what we just talked about in terms of the email, the hotline, and your use of Verge.
Right, we certainly still encourage, particularly for something that reaches the patient or for a patient-specific event, we certainly encourage our associates to put reports in. When we moved from Midas to Verge, the reporting became so much easier that people are much more inclined to put in reports. But we became aware that certainly it sometimes happens that you may have someone who, for example, if you have an associate who's walking by a room and sees something that could be an issue and takes care of it, they may not know the patient's identifiers. They may not be able to put that information in, or some of our associates may not even have computer access readily available. So to have mechanisms, particularly for those people, and especially, again, for those, I saw something and while I'm thinking about it, that's really not very safe. We definitely encourage reporting that sort of event through that sort of observation through the alternate mechanisms. We had a lot of reports of things like, that there's, at night you can't see that bottom step because there's no yellow stripe on it, and I almost fell going out of the building. A relatively easy thing to remediate, but something that somebody sees, and we love it that people are looking, thinking about it, and sharing it with us.
Oh, absolutely, absolutely. Sounds like your marketing campaign was very effective. So we've got another follow-up question. It says, to maintain HPI/PSO type classification of events and occurrences, do you go back into Verge to determine the correct classification? So are you guys classifying your event based upon, I guess, the HPI taxonomy?
Well, Abraham, this is Jennifer. Just to clarify two different things there. Are they asking about the safety event classification?
About the level of harm classification?
Or about the level of harm and the categories?
Let's see. So let me read what they typed, and we may have to do some interpretation here. To maintain HPI PSO type classification of events and occurrences, do you go back into Verge to determine the correct classification?
Okay, so I'll kind of maybe try and address it in a couple parts, and hopefully we hit what this person's asking.
Okay.
In terms of the event types, like is it a fall, is it a medication event, a lab event, we aligned those with the PSO event type. And that is something that we're still having a little bit of a challenge with because we have a lot of events that are falling into the other category. So we're working with Verge right now to continue to optimize that. Those of you guys working with the PSO, there's not always a clear, clean crosswalk of all the event types in your event reporting system and what crosswalks over to the PSO. In terms of the HPI safety event classification, we do not have that currently built into our system to identify things as near misses, precursor levels 1 through 4, or SSE levels 1 through 5. We do not have that built in our system at this time.
So we do that manually.
Yeah, that we do. We track manually in a separate system.
Okay. I think I don't see a follow-up question, so it sounds like we may have gotten to the essence of what the person was asking about. You all made reference to reporting by all types of associates. Have you guys had any ability to gauge the level of reporting by your physicians? I know many organizations struggle with physician reporting. Have you have any idea of how engaged your physicians are in your reporting system?
We've seen a lot more physicians reporting, sometimes mostly via the email option, but we've definitely seen an increase in physician reporting. We've also seen a shift in sort of physicians through the safe reporting system giving kudos to other associates as well. So we've seen some improvement there.
Wow. And Michelle, to follow up on that, so you've definitely seen improvement in physicians using the email option?
Using all options, but I think because, I guess just maybe the workflow, it's probably easier for them to send an email. So we have a few ways for people to access our current reporting system. Again, it's Verge. So there's an icon on the desktop, which sometimes, like Dr. Biggany stated, that may not be readily accessible to people, but definitely people can do emails via their phone. So I think people just choose to report in ways that are more readily accessible to them. And just like she stated, if there's something major that comes through via an email, which you typically need more information about, we do ask that they go ahead and submit a report via the Verge system.
Well, I think that's one of the...
Sorry, go ahead, Abraham.
Okay. Well, actually, someone else typed another question, so let me go ahead and read the question. I'm sorry if I missed this, but through this process, did you find reporting increased primarily through the email hotline options, or did you also see significant increase in Verge reporting?
I think the answer is both. Initially, we rolled out the two alternative ways to report around the same time we rolled out the contest. We would have a party for whatever department had the most unsafe condition near misses and good catch reports. And then we also at the same time educated about the way to use those tools to get people comfortable with them. So certainly we saw a big surge in that use. And then we went live with Verge and we educated about it, and its use became easier. I think we saw an increase in reports through that system, in part because it was easier to use, and in part because we were in the process of having a culture change, that when people see things now, they do, one of the things that comes to mind is that they do report. We also use all those event reports that we get every day to structure our morning safety huddles at each of our hospitals.
Yeah, so we saw a shift from those emails, pretty much people, more and more people going from the email to entering them directly into Verge.
Well, yeah, this person says they asked because their staff complain of the difficulty in entering into their reporting system. So I think what you guys have done is somewhat brilliant in that you sort of legitimize the use of the phone and email as a way of reporting option, because for some folks, that's simply easier. And I would suspect that once you legitimize that and allowed folks to do that, and then in a few occasions follow it up and then encourage them to then enter into the system, to me, that was a very, very effective strategy, because I think ideally we all want everybody to use the one system, when in fact it just doesn't work for everybody naturally. And if you can allow these other options, I'm not surprised you're seeing benefits in your overall program. So.
Yeah, and I mean, I think making sure you set up good processes with your team of how the email and the hotline are going to be checked regularly, and as the question was earlier, how that information is going to get aggregated and put in with the main reporting system are important conversations to have, so that your reporting stays timely. So those are good. And then, you know, I think eventually we'd love to get to a point where we can sunset one or both of those, but being as we've only been live on our new system for about 6 months, we're not ready to do that yet. And in terms of optimization, we are also working with our newer EMR, which went into place in June of 2018. And we're looking for how we can maybe make the two systems work a little bit better, so that somebody could enter a report or hit a link to enter a report directly from the EMR, and it would auto-populate some of the information.
Yeah, so that's supposed to happen probably third quarter.
Yeah, so that's on deck. And then we're also adding visitor and associate reporting to this system, so that'll be a one-stop shopping as well.
We also have are getting ready to go live with the claims module, and we have the associate injury module, so we can move reports from one system to another or have them in multiple systems at once if there's something that may be a risk issue at the same time as a safety issue or an associate issue that comes in as a safe report. So it does give us more options. But I think a big part of our goal was that culture change, that you don't just report it when something hurt somebody. You report it when something happened or something almost happened or something could have happened that could have caused harm.
Okay, I've got a couple of, we were getting close to time, but I think I may be able to squeeze in these other two, this one comment, and I'll just read it and you guys can translate it and respond as you deem appropriate. How did you apply recognition for entering events with staff without threatening the confidentiality of reporting? Many staff at our facility have given negative comments when approached for other information.
We allow anonymous reporting, and the feedback that we give generally is to the manager, because we share we can electronically share the events with the manager, who is the person who may need to investigate and respond. And so far I'm not aware of any negative feedback that we have, but I would think that people who are concerned about that would probably use the anonymous reporting option.
Or like with the good catches, like how did we, I mean, those weren't typical negative things. How do we do that recognition?
Well, you know, we have the iCare values, which is an online sort of peer recognition program that we have. And I think it's just a matter of being careful with wording as far as, you know, how do you put that across in the system as far as recognizing that person for speaking up.
And I mean, I do think we're working very hard, certainly with our Just Culture work and our HRO work, to thank people for reporting. If you make a mistake and you report it, that's a great thing. That's certainly not something that you should feel it's punitive that someone follows up on that. And I mean, I think we really have not seen that as an issue. No.
And it sounds like the fact that you do give folks an anonymous reporting option, that may also be part of what's addressed that issue, that if folks have that level of concern, they know they can still report and not have concern. So we're at our time now.
I mean, because typically it's, you know, an associate A, B, and C, so it's not really, you know, letting them know, not giving too much detail, still recognizing but not giving too much detail.
There are certainly some situations in which someone, for example, reports inappropriate behavior on the part of a physician or a colleague that might have created a safety hazard, but you can see that someone might be apprehensive about having that followed up and having themselves identified, and people often use an anonymous option when that happens.
Okay. Well, I appreciate you guys giving us some time this afternoon. Just based upon some comments we've gotten in the chat box already, folks really appreciate the information you shared and thought it's been a great discussion. We encourage everyone when we log off to please take 30 seconds or so to complete the quick survey that will be at the end of the webinar. And we look forward to having everybody join us next month, fourth Thursday of the month at 12:30 for our next monthly webinar. Everyone have a great summer, and again, very many thanks to our colleagues at Mary Washington Healthcare.
Thank you.
Thank you so much.